So tell us a little bit, Tricia, tell us a little bit about your background.
Oh, perfect. I have been an ER nurse for 12 years
Uh-huh.
and fulfilled lots of roles within an emergency room, from education to trauma to charging to some managerial. So
Wow.
I love taking care of a injured patient.
Yeah, and Carolyn, you've been in the ER before you came to Summit for 18 years.
Yes.
Yeah, so a lot of experience.
Mm-hmm.
What did you learn from being in the emergency room that's relevant to what you do today?
I think one of the most important things I learned is that every time you interact with a patient or you see a patient, you have the opportunity to have a fresh set of eyes on that patient, right? You're able to look at that patient globally and form your own opinion about what's going on. We've talked before about biases. There's like diagnostic momentum. So sometimes a patient will come see us in the office and the consults will be, this is the problem, check them out for this problem. But it's our opportunity when we see that patient to look at them globally and figure out, do I think that's a problem or do I think it's something else? So
You're super good at that.
Yeah, I love that.
And what do you think? What has your experience from the ER taught you about?
I think in listening to the presentation today, I thought a lot about the importance of like team, like being a good team member and also believing and trusting your team members. I think that's so important.
Yeah, and why is it that in a trauma, the team is so functional, right? Because you presented a video and a case or two of people coming into the emergency room with a trauma, whether it's a trauma 1 or sort of serious trauma 2, not really serious at all, trauma 3. But why is this trauma team so effective?
So I think the trauma team has the same goal. Their goal is to save this life, right? And so they're like laser focused on that goal. And they all are excellent at the things that they do, right? And so if you don't have that skill, then you're not going to have a really good outcome. So I love what you just said, Tricia, about the communication too. When I started at Summit, one of the things that you mentioned to me when I first started was relationships are everything. Like when you have good relationships with people, you can take better care of the patients. And I hadn't really thought about that from the ER. You and I talked about this a little bit, right? We're like, I mean, in the ER, I guess we think of you're a closed unit. You're just like taking care of your people. But truly, when you have good relationships with consultants, you're able to send them a quick text and be like, hey, can you get this patient in, right? And ultimately, the patient has better care and a better outcome because of those relationships. So I think it's critical in outpatient settings to have those excellent relationships, and that comes from good communication, I think.
I think another aspect too is it's really fun to be in the exciting cases. You know, it's like this crazy thing just happened. I'm going in. But what makes you great at your job is having the passion before those things happen. You can't just throw yourself into a really hard or exciting case. You have to like do the work, establish trust with your group so that you're a person that the team wants in the room with you.
I love that. I'm so impressed with the trauma services that we work with, and the ability to function as a true team is just unparalleled in all that we see. And I love that there's a unified goal, and everybody does their job and they do it well, and there's good closed loop ongoing communication. You presented the trauma today, and Dr. Millar was the lead trauma surgeon. And literally, as you were presenting that trauma, he texted me about another patient that we're working together on that's in the ICU now. And that sort of that model of being, whether it's in a trauma 1 setting as the patient's rolling in and everybody's on board, has extended forward into just the day-to-day clinical management. And what a lesson from the trauma services to remember is we should be behaving that way everywhere. And to carry that forward is really what we want to do.
I love that. I love that we talked about this too, kind of going along with that is the debrief, right?
Uh-huh.
So when a trauma one ends, there's a debrief, a discussion about what went well, what didn't go well, how are we feeling about that? What can we do different next time, right? And I think there's a great opportunity in our individual roles and practices to implement that. Like how can we level up? And again, I think what makes it so great, or why the traumas are so good, is because they do those debriefs and they get better so much faster.
Oh yeah.
Because there's immediate feedback and immediate discussion, and like, next time let's do this differently, right? And we kind of talked about this in rounds too, but there's no finger pointing, there's no blame or assignment. It's just collectively as a team, what can we do better? And I love that.
We've made an effort on debriefing lately and have done it after surgeries, actually while we're closing, because you can close and talk and debrief at the same time. So it's a natural setting for debriefing. And then we've been doing a debrief at the end of clinic as well. And so I have found it to be immensely valuable. And it's so fun to take what you learned in that moment and get a little bit better. And then it's exciting to take that understanding and say, oh, I'm actually excited for the next case because we're going to be that much better. And so I would say we should all challenge ourselves to do a debriefing in all of the team efforts that we have in our lives, whether it's our families or our neighborhoods, but also in medicine and clinic with our administrative teams and in specialized settings like the operating room or the emergency room. Great. Well, thanks for coming. The rounds was fun today. Really you make it so fun, and so grateful that you presented, and now you get to go and operate all day. Isn't that amazing?
7 cases.
Yeah.
Let's go.
Yeah, let's do it.
Let's go. All right.
Thank you.
Thank you.